All right, Assalamu alaikum everyone and welcome. I am Dr. Tajwer Shaheryar, emergency physician, MRChem and a mentor and career counselor. Today, we are going to strip down NHS interviews. And this doesn't just apply to NHS interviews, I would say. Applies to every interview, specifically medical, that you will give abroad. Okay, so what are we going to cover today? We will go through what the panelists are looking for, how are they judging your answers, how you can walk in with confidence and structure. Okay. So by the end of this basic session, you'll know how to be able to communicate like a safe doctor, structure your answers so the panel remembers you, and avoid basic common mistakes that immediately can cost you a job. Okay. Right. So, what NHS panels really want to see? Let me start with something brutally honest. NHS interviews are not knowledge tests, okay? They are safe assessments. Panels are evaluating five things. So, are you safe? Do you communicate clearly? Can you work in a team? Do your behaviors match NHS values? And can you reason through a clinical problem safely? Every answer you give, clinical or non-clinical, is assessed through one question. Would I trust this doctor with my family member in the ER at 3 a.m.? If your answer inspires confidence, you're winning. If it causes doubt, you're not. And so let's go over a quick, sorry, let's go over a quick NHS interview structure now. So most NHS interviews follow a predictable pathway. Once you understand the structure, the anxiety drops immediately. I'll walk you through it. So introduction and motivation. This is where you tell us about yourself and why would you want to go with this trust. Second is values and professionalism. Why do NHS? What do NHS values mean to you? Third, clinical scenarios, short emergencies, long ethical dilemmas. That's basically what they're checking here. And then fourth is your current NHS issue. And the biggest NHS issue is overflow. Okay. Work overflow, hospitals are overwhelmed, EDs are overflowing. How can you make that better? So show awareness and maturity. And closing question is why should we hire you? Once you know the pattern, you stop guessing and start performing. Essential structured frameworks. Unstructured answers fail interviews. Structured answers win interviews. So let's break down the framework. I like using the past, present, future method, which is the PPF method. It answers for every, if you use this method for every non-medical question, this is the best way to go. Okay. You want to use this for tell us about yourself because it's going to show professionalism, focus, and clarity. Now, I will go into the details of all of this in our detailed workshop. These are just the basics. So I'm just going to cover superficially about all of these structures. But in the detailed workshop, we do cover all of this, okay, in detail and how you can tailor those questions. What this means is basically past, present, future. So whenever they ask you, tell us about yourself, you tell them something from your past, follow it up with what you're doing currently in your present, and then how you're going to make it better in the future. That's how you answer. Second, what I love is a STAR method. And this is usually for ethical scenarios, conflict, like SLO7 kind of questions. You know, if you are from emergency backgrounds, if you're not from emergency background, just remember your SJTs. Okay, so situational judgment testing, basically. So situation is whatever the scenario is, what is your task, what action are you going to do, and what result are you expecting? This is essential for teamwork, conflict, or leadership questions. Then comes your emergency. These are your purely medical questions. I love the ABCDE approach. You can never go wrong with this one. For every emergency scenario, if you use this, panels just relax because they know you're safe. Ethical dilemmas, four pillars plus JMC. So you want to remember these: autonomy, beneficence, non-maleficence, and justice. Your ethical compass must sound solid and balanced. These structures prevent rambling, keep you safe, and they prove that you're a mature person. Now, timing your responses. One of the biggest mistakes candidates make is talking too long. Long questions, 2 to 3 minutes, rapid fire questions, 30 to 60 seconds is what we're looking for. And then comes the clinical answers. And these need to be concise, stepwise, and always remember safety first. So remember, NHS panels, they have very limited time. Usually you'll be given a 10-minute slot, and a few minutes just go in like, can you hear me? Is my mic working? Am I audible? Is the video okay? Those kind of things just waste time. So you have even less time than that. So be realistic, okay? And because they have limited time, respecting timing shows professionalism. And this kind of bleeds into the fact that you want to be well in time, actually well before your interview time, and you've checked all your online systems and they're working okay. So make sure you do that as well. All right, now let's talk about body language and professional delivery. Your delivery matters almost as much as your words, okay? Because remember, it's not what you say, it's how you say it. So sit upright, calm posture, keep your tone steady. Don't rush. I know anxiety works in mysterious ways, but please try not to rush. Smile when appropriate, not excessively, just warmly. Never, and I cannot emphasize this enough, please never bluff or guess rare facts. Okay, it will destroy your credibility instantly. I don't care how well your interview was going. One bluff and you're done. Okay. So when you're unsure, just say, I would escalate to a senior, follow trust policy. Panels love honesty. If it's a medical question that you don't know the answer for, always say, I'm afraid I don't know the answer, but always remember, follow it up. Okay. Try and follow it up with where you can get that information. Like, you don't know it, but I'm going to get it for you. And where can I get it from? So always use a credible source. Okay. Now, the clinical answer. Let's go over the right way to answer and the wrong way to answer. Okay. I want to show you exactly why structure matters. So a wrong answer would sound like, "Mm, maybe check vitals, see if they're breathing, call someone." Now, panels hear this and immediately think unsafe, not hiring that one. A right answer would be, I would approach using ABCDE, call for help early, start CPI if indicated, follow Research Council ALS algorithm. Now, this answer is not only safe, it is structured and guideline aligned. You don't need to be perfect, you just need to be safe. Now, why the right answer works? It works because it hits all the panel's checkbox. Structured, follows guidelines, safety first, early escalation, and it shows teamwork and leadership. This is exactly how the trust decides if you can handle a real emergency. Okay. And how does it show leadership and teamwork? This is where you realize your limitation of what you can do in the current situation and where can you escalate and ask for help. Okay. Because at the end of the day, this isn't a I want to be a hero of this story kind of situation. It's more of a let's make sure the patient is okay kind of situation. Okay. I hope that comes across correctly. All right. So we have gone over this, why this answer works. Now let's look at the preparation steps. Now, interview success isn't luck. Okay. It's preparation. The more you practice, the better you get. And by the end of it, I will go over what we can offer to help you in that department. However, just to look at some of the preparation steps, read your essential documents. Okay, you are looking to work into a new system. You want to learn the system. They will not hire you if they don't see that effort from your side. Okay, because they don't have a lot of vacancies and they're not just looking to hire every um John they can find. They're looking to hire specialists or people that can actually positively contribute to their community. Okay, so read up on your NHS Constitution, GMC guidelines, and NICE guidance. Okay, now I know these are very boring things to read, and sometimes you're reading, but you're not comprehending. And don't worry, we do go over all of these in the workshop that I've promised. And we break it down in steps to give you the relevant information you need. And this is not just for the NHS. If you're going for the Irish interviews, I would suggest looking up those. If you're going for Australian interviews, look up those. If you're going for um, Gulf countries, look up their constitution and essential documents. Okay, be prepared. Second, practice mock interviews, okay, with friends, record yourself. If you can find a good mentor, if you can find paid mock interviews, go for them. The more mock interviews you give, the better you get. Now, this isn't that relevant for non-training, but if you're going for a training interview, please, please, I cannot emphasize this enough. Go for mock interviews, even if you have to pay for it. Because the training interviews are really difficult. They are just like you are in a make or break situation. You've given the MSRA, you have the shortlisting. Now this is the last bump in the road, and I want to make sure that you get over it. So don't risk it. Don't risk it just because you want to save a few bucks. Yes, ideally go for somebody who's available, free, and giving good advice. But if you cannot find somebody, please prepare well, and then after you have burnt out all your free resources, go for a paid one and get professional help. Okay. Third, reflect on experiences. Okay. Prepare 2 to 3 stories for your teamwork, leadership, conflict. Do not use ChatGPT like a generic format. And there are ways that you can use ChatGPT to help you. There are ways to help you with AI, and we will cover this in the workshop, how you can use AI effectively. But just making a prompt or just saying, ChatGPT, can I get a teamwork story? Don't try that. That's going to fail. Four is research the trust. Okay. Why that hospital? Why you want to go there? Why do they have this vacancy? Who are the panelists? Read up on the panelists, see what their specialty is. You will always find somebody like, for example, I do basically majority of the time emergencies, right? So I always look at who the doctor is in the panel, who is the HR person, and then I want to look up their profile. Ideally, you could just find them on LinkedIn. Um, and see what are their specialties, what do they specialize in, what is their interest in, and then work up those things on your CV, go into the details of that and try and impress them that way. Okay. If somebody is into ultrasound, you want to highlight ultrasound on your portfolio. Okay. You want to talk about ultrasound more to appeal to them. Okay. Try these little steps. If the HR person is somebody who has been recently posting a lot about time management and professionalism, you want to highlight those little things. It's always good to, play with the psychology of what they're thinking. It's a good thing to have. And please remember, the recruiters or the people who are taking your interview also use these tips and tricks. So if you use them to help yourself, it's not a bad thing. Lastly, polish your delivery. Okay, clarity over jargon. If you use a lot of sentences like I would, okay, you want to get rid of these clutter words. Okay, try and excuse me for preaching when I'm not doing it myself. I've realized I use the word okay a lot, so I would apologize for it straight away. I am trying to improve on it, but you see what I mean. I struggle with this, and I know many of you struggle with these not jargon words, I would say clutter words that make your speech less polished. So the better clarity you have, the better speech you have, avoiding all of these clutter words, the better polished your delivery is going to be. I hope that makes sense. Essential reading list. So these are your foundations. If you nail these documents, you become unshakable. All right. NHS values, GMC good medical practice, nice emergencies. Now, this depends on what interview you're going for. If you're going for an emergency interview, you will have to cover all of them. If you're going for obs gynae, for example, read up on latest RCOG emergency guidelines. If you're going for pediatric, read up on their emergencies, ENT, ortho, whatever. You need to read up on the emergencies of all of your specialties specifically because that is what they will ask. There is going to be one emergency question there for sure. The second question is going to be any new guideline that's come in or changed for sure. So these are the two relevant questions you're going to have in your medical section or your clinical scenario section. Okay. Third, Research Council ALS. So you want to do your own ALS, obviously. What I mean by that is if you are going for an emergency interview, you want to read up on ALS. If you're going for trauma, ATLS. If you're going for gynae, you want to read up on the RCOG pregnant lady ALS. If you're going for pediatric, you want to brush up on APLS, NLS, all those. So yeah, any surgical field, ATLS, you want to read up on, medical field, ALS, and then pediatric and gynae, you want to read up yours. I hope that is clear. Sepsis guidelines are very common in all fields, medical or surgical. Sepsis comes everywhere, read up on it, and Mental Capacity Act as well. NHS values in practice. Now, values aren't just memorized, they must appear in your behavior. Compassion, respect, equity, improvement. When you weave these into your answers, sorry, I'm just having a look at the comments. All right, sorry. So when you weave these into your answers, naturally, panels feel that you belong in the NHS. Common interview scenarios. These will appear in almost every interview. Emergencies, so chest pain, sepsis, rest, anaphylaxis. Remember to use your ABCDE, escalate, use guidelines. Ethical dilemmas, you're going to end up having capacity, safeguarding, confidentiality. You want to use your 4 pillars and GMC, workforce or their guidelines. Teamwork, they will ask you about conflict, leadership under pressure. Always use your STAR method. For professionalism, they will ask you about mistakes, complaints, bad news, staying honest, reflective, and safe. Okay? Handling difficult question. I'm so sorry, the font is very small, but it's still readable, and I'll read it out to you. I hope that's not an issue. So when you don't know something, stay calm and stay safe, okay? Being safe is always better than being, outright unsafe. So use the safest option. Like, I don't know, and I'll figure it out. I will find somebody who can teach me. I will go look up the guidelines and I will do the best I can, or I will ask for help from my consultant. Okay. So if unsure, escalate, follow policy. If ethical, always apply your pillars. If resource limited, you want to prioritize safely. Families don't want brilliance. They understand you're human. They understand that you cannot learn every guideline under the sun. They want reliability, somebody who's willing to improve themselves, continue working on themselves, and is willing to learn. They can teach you knowledge. Anybody that we hire, and I'm saying this as somebody who's been hiring for a few years now, anybody who's looking to hire can train you. Okay, they know that they can train you. They can give you the knowledge. What they cannot give you is core values like safety, teamwork, leadership, taking a team to the best level they can, time management. All these things are, I wouldn't say inherent, but they are somewhat in your behavior. And you want somebody, as a hiring person, you want somebody reliable. Teaching you can do, knowledge you can impart, they can learn the system as long as they're willing and open to do it. And that's what we're looking for. Current challenges in the NHS. So they want to know if you understand the real world, like staff shortages, burnout, increasing demand, technology integration, and health inequalities. Your tone should be realistic but optimistic. Okay, don't give a very doomsday kind of picture. Be hopeful. Nobody wants um what do you call it? A crying Nancy. I'm not using the phrase correctly, I believe. But yeah, nobody wants someone who's like always negative and critical. Okay, they want somebody hopeful on their team, always looking at the bright side. Show that you're ready to contribute to solution, demonstrating resilience. So NHS medicine is tough. They assess whether you can cope. So recognize when stressed, okay? Acknowledge when you're under pressure and need support. Are you able to seek support early using the available resources, including colleagues, mentors, occupational health? Are you able to maintain a good work-life balance and healthy coping mechanisms? And are you willing to learn and grow and treat every challenge as a learning opportunity? They're not hiring superheroes, they're hiring humans who recover well. Now, the closing question strategy is, why should we hire you? Is your moment to shine? Answer in 3 steps. Okay. First, say your strengths. So, safe doctoring, communication, teamwork, whatever you feel comfortable saying. Fit. This is how your skills match the trust need and the role they're looking for. Enthusiasm is why you genuinely want to work there. And I would suggest being animated. Okay. Don't be robotic. I know sometimes English not being your first language, you struggle with how you express your keenness to work with them, but try to practice that in front of the mirror and see how animated you look when you're trying to sell yourself for that job, like the enthusiasm that you have to positively contribute to that role or that trust. This is the last impression. So make it strong, confident, and warm. Final golden rules. Let me summarize everything in the simplest way, okay? Patient safety first, escalation early, NHS values always, structured, time-limited answers, calm, confident, professional delivery. Do these 5 things and you will transform your interview performance. Now, as we finish, remember this. NHS panels genuinely want you to succeed. No one is trying to fail you. They're simply trying to protect patients. The best doctors balance clinical skill with compassion, confidence with humility, and independence with knowing when to ask for help. You're ready, and I wish you all the best in your NHS interview journey. Thank you so much for listening, and for more guidance, this is my email and this is my social media, and if you still have some questions, leave them down below and I'll be replying them in the live chat. I'll see you in our next session. Allah Hafiz.